Maisha ni health. Maisha ni health.
It is estimated that non-communicable diseases account for 27% of all deaths suffered by Kenyans. That's equivalent to almost 100,000 people per year. This is according to the World Health Organization. Now, today's edition of Maisha ni Health will focus on non-communicable diseases. In this episode, we head to the county of Meru, which according to statistics has the highest prevalence of cancer. We'll be talking to people on the streets of Meru town, and we'll also bring you case studies about non-communicable diseases, including cancer. We'll also later on the show host expert panelists and wananchi in a town hall meeting to discuss more of the same. We'll also get a view from the Ministry of Health Command Center with the Cabinet Secretary. Mutala Mukosia spent some time with the people and documented the following stories.
We are in the great county of Meru, and today we are here for one thing, and that is Maisha ni Health program. On this episode, we are going to talk about non-communicable diseases. So we're going to talk to the common mwananchi of Meru County, talk to the professionals, and also the leadership of this great county. Remember, this is Maisha ni Health program. My name is Mtala Mkosia.
Maisha ni Health.
Maisha ni Health.
Maisha ni Health.
Maisha ni Health.
Maisha ni health. Maisha ni health.
So today we are at Meru County in Kinoru, and we are meeting Mzee Laban Kaburu. Mzee Laban Kaburu has had a journey with cancer, and he is going to share with us his journey.
Nilikuwa hospitali kwa shughuli zangu za kawaida, sasa hii matibabu ya kawaida. Sasa ndio nilikuja kugundua kuna kitu inaendelea kwa mwili yangu isi ya kawaida. Nikaenda nikaeleza daktari. Daktari akaniambia ile symptoms ni za cancer. Atanifanyia test. Sasa akanipatia date za kuenda kufanyiwa test. Na hiyo test inaitwa urology. Result kutokea nikaambiwa ni cancer, lakini haijatokea, iko stage ya chini. Haijaenda mbali sana. Akaniambia vile sasa utafanya, tutakutuma Nairobi KU. Uende ukafanyiwa radiotherapy. Nikaanza kushangaa nitapata pesa wapi. Daktari akaniambia si uko na nini? Kuna NHF. Nikamwambia ndio. Akaniambia sasa hiyo ndio utatumia ikusaidie. Lakini haitakusaidia sana, lazima utakuwa na pesa yako. Kwa sababu watakuwa wakikulipia ile sections utafanyiwa radiotherapy. Kwa hivyo watakulipia hiyo tu, hakuna kitu kingine watakufanyia. Nikaanza kushangaa nitapata pesa wapi, kwa sababu huku hata ikiwa nitafanywa hiyo nini, nitaenda huko lazima nitatafuta nyumba ya kulala, chakula, transport, na saa nyingine wameandikiwa mandawa na mimi utanunua, kwa sababu NHF hawezi kukulipia, inakulipia tu sections zile unafanywa. Nikamaliza hizo sections, zilikuwa za siku 36. Nikarudi hapa Meru. Sasa si kusema kwa sababu nimeenda huko ile mgonjwa imemalizika kabisa. Hapana. Lazima utakuja huku na ushughulike na mandawa. Na hiyo mandawa utakuwa ukinunua mwenyewe. Na saa nyingine hata una kazi. Naendanga hospitali kwa kemo. Naandikiwa mandawa, na kama kuna picha NHF inanisaidia na hiyo section ndio nilipia zote, na ni pesa mingi. Sasa mimi nashughulika na hizi zingine za dawa, za picha, matumizi haya mengine yangu. Nataka mtu aende hospitali mapema, aende angaliwe. Na asiwe na yaani asifishe. Aenda aone daktari na daktari amweleze vile anasikia na simpishe, ili daktari amfanyie testi aone kama kuna mambo yanaendelea kwa mwili. Mimi serikali hata ingenisaidia kulipa hiyo pesa ya NHIF ningefurahi sana, kwa sababu mimi sina kazi ya permanent. Natafuta barua yangu nakula, alafu nyingine ile inabaki naenda nalipa hiyo NHIF. Sasa hata wakinisaidia na hiyo pesa ya NHIF naweza kusema ni asante.
Unahitajika kwenda hospitali kwa kulingana muda gani?
Once per every 2 months ama moja, kulingana na vile mgonjwa inaendelea kwa mwili. Ikienda juu unaenda kwa mwezi moja. Alafu ikienda chini unaweza kuenda hata baada ya miezi miwili. Ni kulingana na mwili.
Nashukuru sana kuweza kutukaribisha nyumbani kwako na kupata kuzungumza na sisi na pia kuweza kuhamasisha watu.
Many cases of non-communicable diseases are the consequences of lifestyle choices that we make. Why did we choose Meru County to highlight on non-communicable diseases? Non-communicable diseases are many, but in this episode we shall focus on cancer.
Today we are at Meru Teaching and Referral Hospital. So we want to speak to some of the professionals here wanting to know why Meru County has many cases of non-communicable diseases.
Why Meru and not Embu, not Nyeri? Why don't they have this kind of cancers? So we want to see, is it the genetics that predisposes, or is it something else that we are yet to pick out? That is what we have been grappling for the last, I think, 3 to 5 years, trying to figure out why Meru County. There are so many anecdotal papers that have been citing Meru being a miraa growing zone, chewing miraa, but in all fairness, there is no concrete data that actually points that miraa chewing actually causes any of the cancers that we see. We've seen a steady increase in the number of cancer patients from all over, not just within Meru County, but also from neighboring counties. Our patients, when they come the first time, they have to go through counseling sessions, both palliative and nutrition. And this is important so that they're able to know exactly what they're suffering from. So that's what we call disclosure, how they're going to be treated, the form of treatment, the duration of the treatment, the side effects of the treatment, and how to manage those side effects. We pay a lot of emphasis on the nutritional component so that when our patients live here, there is continuity, so that when they go home, we emphasize on them feeding as regularly as possible so that the medicine can be effective in their system. Some of the treatments that we offer to our patients are really costly, ranging from as low as 5,000 to as high as 100,000. And NHIF caters for that fully. That, in a way, gives us hope that our patients will live to see the next day. So NHIF for us is one of those things that, as a practitioner, it's a must for all my patients. It's a must. If you don't have it, go get it. If you can't get it, find a way of getting it, but have it. There are certain things that we can avoid, which in a way can help prevent or keep away some of the things, some of the predisposing factors, like just eating healthy, having a vegetarian diet. Not that you stop eating meat, but you can alternate the meat products. A lot of vegetables, drinking a lot of water, exercise, regular checkups. That way we are able to pick out early lesions and treat them early, whereas we are also able to prevent some of the cancers that come up as a result of overindulgence in some of the predisposing factors I've alluded to.
It is public knowledge that Meru County appears to have a very high prevalence of cancer cases. We have registered ourselves. We have a cancer clinic running at the Meru Teaching and Referral Hospital, and the oncology clinic for which we run a database for cancer or a cancer registry. In the year 2021, for example, the cancer clinic attended to 4,506 patients, of which 545 were newly diagnosed with cancer, meaning the other 4,000 are patients who are on follow-up from the previous years. And basically that translates to every month that cancer clinic attends or does diagnosis for 45 new patients every single month. Yes, there is the narrative that maybe there is something that makes Meru a hotspot for cancer, but I think also the availability and the access that we have availed in this county for cancer care, for cancer diagnostics, would obviously make the numbers go higher. Remember, this clinic serves patients from the neighboring counties, Tharaka Nithi, Isiolo, Marsabit, and parts of Laikipia. As long as we continue having a robust clinic that handles cancer patients, our numbers will continue to be higher. Remember, UHC, the C in UHC is coverage. It's about coverage in terms of ensuring services are reaching the person down to the village. And we have tried to improve that coverage by ensuring that we have dispensaries, health centers, level 4 hospitals that are operational, that are well equipped. With support from AMREF as a partner with Meru County, we have been able to map out the areas where there are indigents or people who cannot afford to pay these NHIF costs, and we as a county are going to pay for that NHIF. We used to send all our patients to Kenyatta National Hospital. Today, if you go to a majority of the county referral hospitals, you will find some form of cancer care, be it diagnostics, be it treatment. Today, Meru County has 2 oncologists, medical oncologists, working in that clinic. We have about 5 oncology nurses working in that clinic. We have doctors who are not oncologists working in that clinic. We have clinical and oncology pharmacists working in that clinic. And we have set aside today a separate area, an annex within the hospital, where we have sourced for funding through the national government, through the World Bank. And in the coming months, we shall start a construction of an ultra-modern cancer center. By the end of this year, we shall be able to offer radiotherapy. And that now becomes the entire spectrum of services that can be offered for cancer patients.
Tunazungumza na wakazi wa Meru kupata kujua kama washaitenga muda aidha akiwa mgonjwa ama labda yeye si mgonjwa, lakini kupata muda wa kwenda kufanywa ile medical check-up. Kumbuka show ni Maisha ni Health na mimi ni mtaalamu Kosia. Natakuwa tunazunguka kila wakati, tunazunguka kila sehemu watu wapate kujua. Acha nisumbue hapa kiongozi. Kiongozi, naomba kusumbua kidogo. Ushaipata muda ukasema tu wacha niende medical check-up. Labda mimi ni mgonjwa, labda mimi si mgonjwa, lakini wacha niingie medical check-up.
Sasa haifanya hivyo.
Kwa sababu gani?
Sasa kingo mgonjwa, sasa nitaenda kufanya nini? Check-up tu.
Check-up saa nini, saa kama uko fine. Taenda check-up ya nini?
Huwa anachukua muda, unajua saa kulingana na miaka vile mtu anaendelea. Ukiwa saa ile uko young ushughuliki. Lakini after 40s unafaa ushughulike. Sababu inasemekana after 40s ile immune inaanza kutelemka.
Jaenda.
Sababu gani?
Sababu sisikii mwili wangu ikiwa na kasoro. Sijaanza kusema ukweli.
Mara ya mwisho kwenda hospitali ilikuwa lini?
78.
Sijaenda.
Sababu gani? Kwa sababu gani?
Sababu sina pesa, siendi hata na meza tu dawa Panadol na meza tu nakaa tu.
I am with Mzee Alex Nyaga here, and his story is similar to that of Mr. Laban Kaburu. Kwanza mimi ningependa kujua hii safari ilianzaje hadi ukajipata hivi leo hivi?
Kuanzia mwezi wa 2021 nikaanza kula chakula, nikula kidogo. Hata bibi akakuwa na furaha sana, akawa na skuli. Kutoka hapo nilienda hospitali ya Chuka Jendo, nikapimiwa, nikaangaliwa, nikaandikiwa barua niende kliniki. Nikaenda hospitali ya Konsolata Chuka, ya admitted for 1 week. Kaniambia niende Meru niangaliwe kwa sababu nilikaa nakula chakula alafu natabika. Kwa hiyo nilienda huko kapimwa, alafu nikaweka machini kwa alafu nikaenda huko nikatolewa kakitu huko, nikaambiwa kataenda Nairobi. Alafu after 2 weeks nikaambiwa niende nione hiyo results. Kaambiwa lazima nifanyiwe operation ya tumbo. Nikaenda operation ya kwanza, nikaenda ya pili, hata ya tatu. Nikaambiwa hata hiyo ni ugonjwa utakuja hapo kwa hata hapo nikafanyiwa operation nyingine. Nikiwa natumia ile NHF. Kaambiwa sasa pesa zangu inamalizika, wengine shughuli yenu. Toka hapo tukafanya harambee, tukalipa hiyo pesa, alafu nikazua nyumbani tena. Kutoka hapo sasa nikawekewa hii mpira ya kula, kanitolea hapa. Sasa mimi nawekewa chakula hapo na mate inatokea hapa. Mwishowe ukaniambia waitume Meru, hiyo ama hiyo ugonjwa unamalizika. Sasa mimi naendelea tu kwenda kliniki. Katika shughuli zako za kwenda hospitali na kufanyia matibabu, umeweza kujifunza nini kuhusu ugonjwa wako? Anatemu waru. Akiona tabu, aende kwa daktari haraka, aitibiwe, angaliwe ni nini.
To gauge the prevalence of non-communicable diseases, we asked Kenyans if they knew someone affected.
Nimesikia lakini hakuna mtu najua.
Bado.
Sijajua anything kama hiyo. Tumesikia kuna wanaugua na hayo magonjwa. Na wengi wanateseka sana.
Na wengi wanafanya kutafuta matibabu ama kwa tu nyumbani.
Wengi wanajaribu tu kutafuta mahali inapatikana. Kama ni ile hospitali tuko nayo hapa, hizi cancer center, wanajaribu kutafuta tu vile wana uwezo.
Evidently, non-communicable diseases are a major class of ailments affecting Kenyans. Is our healthcare infrastructure well prepared to deal with them? The aspiration towards universal healthcare is what informed the rebranding of the former National Hospital Insurance Fund to the National Health Insurance Fund. It was not merely a change of name. It came with enhanced capacity to finance public health, with better quality, easier access and affordability for all as the guiding principles. Cancer treatment centers are now spread across the country, unlike a few years ago when the only facilities treating cancer were found in Nairobi.
Thank you, Mutala, for a very interactive session. Now, the people of Meru have very many questions with regard to non-communicable diseases and especially cancer. Time for us to take a short break. When we come back, we'll be hosting expert panelists in front of an audience to talk more about non-communicable diseases. You're watching Maisha ni Health.
Maisha ni health. Maisha ni.
Welcome back. Time for us to have that discussion with the experts.
Maisha ni
This is yet another edition of Maisha ni Health, our continuing coverage of universal health coverage, the progress and achievements of the same, and discussions with the people behind this as envisioned in the government's Big Four agenda. Today, we will have a special focus on cancer care and awareness. And we're having this discussion right here in Meru, and we'll have a panel discussion with three guests. I will introduce them shortly and in front of a live audience. And I'll begin with my immediate left. We have Dr. Mwenda Valerian, an epidemiologist from the National Cancer Control Program, Department of Non-Communicable Diseases, Ministry of Health. Next to Dr. Mwenda, we have Ruth Muya from the National Cancer Institute of Kenya. And last but not least, we do have James Kiremi. He is a Chief Officer of Health, Meru County. Good morning, ladies and gentlemen, and karibuni sana. Later on in this session, we'll be fielding questions from members of our audience. But before that, let's have a brief discussion. To my panelists, probably expound on what exactly non-communicable diseases are and which other conditions or illnesses fall under this, apart from cancer. Let's start with you, Dr.
Some people refer to them as chronic conditions. Basically, these are conditions that cannot be transmitted, cannot be passed from one person to the next. As opposed to what we call communicable diseases, which are conditions that can be passed from one person to the next. Cancer is not the only non-communicable disease that is there. Actually, there are four major groups of diseases that constitute what we call non-communicable diseases. Cancer is one of them. The second is what we call cardiovascular diseases. These are diseases that affect the heart and the blood vessels. The third is what we call diabetes. Diabetes, what some people term in Swahili, ugonjwa wa sukari, ugonjwa wa kisukari. The fourth is what we call chronic respiratory diseases or chronic lung conditions. Those are the four main types of non-communicable diseases. However, there are many other types of non-communicable diseases that affect people across the world and also in our republic.
How prepared is the public health system to deal with these non-communicable diseases?
I think you need to probably look at it twofold. Is there infrastructure and is there human resource? And I think if you look broadly in that sense, then you would ask, is there a human resource capacity in the counties, in Meru County, to deal with non-communicable diseases? Yes. So do we have capability for diagnostics in this county for the non-communicable diseases? I would say yes, all the way from cancer, diabetes, hypertension. Of course, there are areas within county or the smaller facilities, level 2 facilities, who may have limited capacity for some areas in terms of diagnostics, but that does not mean that our patients do not have access to diagnostics when and if need be.
Is there medication available for cancer? What, if at all there is, what kind of medication is it?
The approaches of cancer treatment, of course, are various, starting from use of chemotherapy or drugs to treat cancer, use of radiation, and use of surgery, among others. I can say we are good as a country to respond to cancer in terms of treatment to a very great extent, comparing from what has happened in the last 10 years. Of course, there are challenges. Nevertheless, the issues of availability of medication and affordability of the same. Within a very short time, we should be able to treat all cancers in the country, and no Kenyan should be able to leave the country seeking for treatment elsewhere. It is possible, and the country is on the right track.
Health is a devolved service, but the ministry still oversees all these services. Is there awareness on availability of cancer care and access to it available to this community?
As a program in the ministry, we've actually realized in the last 2 or so years that we don't just need to set up these centers. We don't just need to bring all these equipment. We need to go out there and find a way of communicating effectively to the populace to know that these services are available and to even empower them to uptake these services. Not just on treatment, across the entire cancer control continuum, starting from prevention, to what we call screening, meaning going for checkup when you have no symptoms, to early diagnosis, then to diagnosis and treatment. But we need to inform our populace what is available and where it's available and how they can be linked up. The second aspect of financial access, that's I think a major area of focus now, and we've been working on various initiatives to reduce the cost of cancer care in this country. One of them is riding on the UHC discussion. And as a program, we've ensured that key aspects of cancer control, right from screening to diagnosis, is captured within the UHC package. The second aspect is actually working with NHIF to restructure the cancer packages that are covered, all right? So I would want to request the people who are here communicate to people for the moment to pick up NHIF, because you know soon it will be covering the entire array of cancer control services, from diagnosis to treatment and even what we call rehabilitative care.
What can I do to stop myself from getting cancer?
We have so many risk factors for cancer. There are some that we can do something about, there are some that we cannot do much about, all right? So the ones we can do something about, we call them modifiable, meaning we can act on them. Unfortunately, they contribute to around 40%, all right? There are many other factors, things like age, things like exposure to radiation in the universe, all right? Things like our genetic makeup, who we are as people. We see different cancers appearing more among black people than white people and Asians. There's nothing we can do about that. We can't change our race, we can't change our sex, okay? But there are a few things that we can do something about. And those are the things that we encourage all of us to do something about. There are 4 main modifiable risk factors for cancer, friend. One of them is use of tobacco. The second major risk factor for cancer is abnormal use of alcohol. The third common risk factor for cancer that we can do something about them is inadequate physical activity. Okay, we are assuming what we call Western diet that is heavy on carbohydrates and what we call refined carbohydrates. So these are factors that we can do something about. There is something else we need to do. It's not just avoiding those factors. There are other concepts of cancer control. There is something we call screening. Okay, screening means being checked for certain types of cancer before you have symptoms. There's a second concept called early diagnosis. Early diagnosis means if you have a symptom that persists, especially that persists for some time, get a quick medical checkup. So these are the 2 things that we need to focus on, in addition to living what we call healthy lifestyle.
Dr. Mwenda mentioned the fact that some cancers have to do with age or even gender. But the question is, can the youth also be afflicted by cancer?
We have over 3,000 cases of children diagnosed with cancer every single year in Kenya. And the youth also catch cancer again. Quite of it is affiliated to the childhood cancers, so that is persons below 19 years of age also catch cancer as well. But of course, as years pass, the chances of developing more cancers increases, and therefore that's why the age factor comes in. We see different more cancers in the elderly as opposed to the young persons. And the other reason is cancer takes time to manifest. For example, cancer of the cervix, which is preventable among the youth and the children through vaccination, can take about 20 years to develop. So perhaps then it starts from age 20, and by the time it's diagnosed as cancer, then the person is around 40, 35 years, and that's why then the youth may look at it like it's not their cancer, but if interventions are done at the early age, change of risky sexual behaviors for cancer of the cervix, particularly vaccination against HPV for ages 9 years to 15 years, girls in Kenya, then would be moving towards eradicating cancer of the cervix, of course, coupled with screening and early detection and the treatment. We could eliminate that particular cancer.
Seen in some communities, stigma is indeed a bigger problem, even affecting access and availability of services. How much of it is a problem here in Meru?
From my position, I think there isn't an issue of stigma in Meru County when we talk about cancer.
Meru County is very lucky that they have managed to overcome the issue of stigma and discrimination. It's totally different elsewhere. In various other communities in Kenya, including the community I come from, cancer is seen as a curse, Cancer is seen as, someone sinned or did something against God. And also cancer is seen as witchcraft. And therefore, there is a lot of stigma around cancer, and people don't understand the condition quite well. So cancers of the reproductive system are highly stigmatized and are surrounded by, cultural norms and taboos, and therefore, people are not willing to come out for treatment and care.
Yes, you're still watching Maisha in Health, our continued special series of programs highlighting the progress and achievements of universal health coverage as envisioned in the government's Big Four agenda. Let's take a break. When we come back, we'll be fielding questions from our audience.
Maisha ni health.
Welcome back. You're still watching Maisha ni Health. As promised, we now take questions from the audience.
Tuenda katika maswali yani ya non-communicable diseases, yani magonjwa ambayo kama ya pepopunda, magonjwa ya kisukari na mengine zaidi kama vile saratani. Kwa hivyo imefika wakati wa kuuliza maswali.
Kuna skrini ya kansa. Watu wa Meru wanaenda wapi? Na kama kuna mahali wanaenda, kama ni Meru General, ni free au ni pesa?
Yes, screening is available. Sometimes when you go for outreaches, or you can come for screening at the hospitals, most of the time it's free.
Mikakati zipi tumezichukua ili kusaidia hawa wanaopata magonjwa za kansa ndio wasikuwe emotionally distressed?
One thing that we worked so hard on, and I think we're able to achieve this last year, is actually passing a palliative care policy. This is the very first time this country has a policy directing how palliative care is supposed to be offered. Now we are able to take action. For instance, to make some of the palliative care support services for cancer available across the country. So now we are moving towards making these medicines more available, and even having more members of our healthcare system, more cadres, being able to administer these medicines so that they are available. The other aspect is supportive care, rehabilitative equipment, which initially, again, were not covered, whether by NHIF or also by other private insurances. So that's something we're working on. Things like stoma bags, things like stents, devices that are used to, like people who have undergone mastectomy for breast cancer. So we've ensured that is captured actually within the UHC package, all right? So that we're able to support these patients across the continuum.
Explain to the audience how NHIF caters for cancer treatment.
Treatment for some cancers is different from others. So initially NHIF under single cover, with specific cycles being covered. So we've been working with them. They requested us that what they need is guidance on what needs to be covered for who. And I'm happy to report that for childhood cancers, we're able to have that advisory and share it with the NHIF. So we are very positive that even before the wide rollout of UHC, that the NHIF will be restructuring the oncology package, and it will cover everything from diagnosis to treatment to staging and even supportive care.
Why is it so difficult for the government to set up a factory or a form of manufacturing center to be able to manufacture cancer drugs locally? Why are we still importing drugs from India and all these other countries?
First of all, it's very, very expensive to manufacture these products. So they do focus on economies of scale. So they're saying that, for instance, they cannot come and set up a factory to just produce for Kenya. The consumption will not be enough to take care of the investment in that manufacturing.
Still better is, again, exploring possibilities of procurement directly from the manufacturers to cut the cost of the agencies who procure drugs on behalf of the patients, on behalf of the government. If that can be explored, then the cost of the cancer drugs would come quite low. And another area that can also help control the cost of cancer drugs is the establishment of the maximum retail selling price, capping the prices for recommended prices for drugs. That is an area that is a low-lying fruit for the country.
Thank you so much. Helping us understand more about the level of awareness and cancer care in Kenya as a whole, and in specific Meru County. Thank you so much for your questions as well, and we hope that you got them answered. Well, ladies and gentlemen, this has been another edition of Maisha in Health, a continued series of programs highlighting the achievements and progress of universal health coverage, of course, as envisioned in the government's Big Four agenda. Maisha ni Health takes another break. When we come back, we get a view from the Ministry of Health Command Center with the Cabinet Secretary.
Maisha ni Health.
As you've heard, non-communicable diseases form a huge part of the disease burden in Kenya. Now, this is what the Cabinet Secretary, Ministry of Health, Mutahi Kagwe, had to say about this.
The burden of non-communicable diseases in the country is driven by socio-economic and lifestyle factors such as obesity, physical inactivity, and unhealthy diets. A majority of Kenyans are consuming fast food, spending hours sitting behind desks and gazing at electronic devices. This shift in lifestyle means that a lot less people are exercising. Advancement in diagnosis services also contribute to the identification and reporting of new cases that previously were not reported. Meru County is under the ministry's radar due to its high burden of cancer cases. This is perhaps the reason why the question of what the government is doing to ensure access to treatment and reduction of cost of cancer treatment featured quite prominently among participants in today's episode recorded in Meru. To reduce the burden of cancer, we have strengthened primary healthcare systems and the cancer referral health system to link primary health facilities to secondary and tertiary health facilities. Additionally, we have also enhanced advocacy to increase awareness on the disease and promote healthy lifestyle choices. Cancer screening services are available at level 2 and level 3 facilities at no cost. We have also established 4 new centers to offer radiation oncology. These include Kenyatta National Hospital, Moi Teaching and Referral Hospital, Kenyatta University Teaching, Referral and Research Hospital, and the recently launched Nakuru Teaching Hospital. Plans are underway also to open similar facilities in the coast, Kisii, and Upper Eastern. The Essential Health Benefit Package under the National Health Insurance Fund will deliver a complete healthcare continuum, including primary healthcare services and services for non-communicable diseases. Another plus is the launch of the National Palliative Care Policy. Health workforce are being trained on patient counseling, among other interventions. We are also working to provide palliative care to improve the quality of life of patients with life-limiting diseases and their families. This is being done through the prevention and relief of suffering by means of early identification, correct assessment, and treatment of pain, as well as other problems such as physical, psychosocial, and spiritual demands at all facilities. So NHIF is in the process also of reviewing its treatment care plans to cover cancer treatment more comprehensively with technical guidance from the ministry. We also have plans to integrate non-communicable disease prevention information in school health programs. Treatment of cancer and other non-communicable diseases can be prevented if we enhance physical activity, eat healthy foods, avoid tobacco, avoid alcohol. These are the 4 major risk factors driving the increase in non-communicable diseases. Remember, Maisha ni health. Protect your health, promote life.
Cancer, diabetes, and hypertension. These are just some of the non-communicable diseases that continue to afflict many Kenyans. As you've heard from the experts, there's something you can do about it. Now, universal health coverage continues to assist many in overcoming these challenges, as you've seen in some of the stories that we've shared. This has been Maisha ni Health, where we continue highlighting the achievements and progress of UHC as envisioned in the government's Big Four agenda. On today's episode, we discussed non-communicable diseases with a special focus on cancer. Join us next week as we bring you Maisha ni Health from the county of Kisumu. My name is Fred.
Maisha ni Health.
I worked day and night so that I may see the light. In daily pursuit of wealth, never knowing that my health is not a guarantee, that it needs a warranty, such as NHIF, of which is what I did, and now I sleep without worry.
Maisha ni Health.